topic is the inguinal canal. So it is the muscular passage in the lower part of the anterior abdominal wall. Actually, this inguinal canal is presented in the lower part of the anterior abdominal wall, and it has some of the relations to the inguinal ligament. So it lies above and parallel to the inguinal ligament. In this sense, can you able to see here? So this is the line alba, inguinal ligament. This is the canal. So this inguinal canal is located just above to the inguinal ligament and parallel to it in the medial of it. This is the medial part of the inguinal ligament. So this inguinal canal is presented just medial part of the inguinal ligament, just parallel to it. So then it is presented in both female and male, but in male it is somewhat larger. And coming to the extension and the direction of the inguinal canal, extension is from the deep to the superficial inguinal ring. It is the extension. Coming to the direction, it is downward, forward, and it is medial. So the direction is downward, forward, and medial. Coming to the inguinal rings, first we are going to see about the superficial ring. So coming here, this is the deep ring, this is superficial ring. So the deep ring is in oval in shape, whereas the superficial is in triangular in shape. So going to see the rings of the inguinal canal. First is the superficial inguinal ring. As I said, it is in a triangular in shape. So this triangular in shape, this superficial inguinal ring is presented in the aponeurosis of the external oblique muscle, and it lies lateral and above to the pubic crest. So here you can see that this is the superficial inguinal ring. So this is located in the pubic crest above, and as I said, this is a triangular in shape. It has base, sides, and apex. Base is related to the pubic crest, and the sides are the cura. Cura, in the sense, it is the fibers from the external oblique muscle. And apex is the intercrural fibers. So these are all about the superficial inguinal ring. Coming to the deep inguinal ring, it is, as I said, it is in oval in shape, and this deep inguinal ring is presented in the fascia transversalis, and it is just above the mid-inguinal point. So here you can see, so this is the mid-inguinal ligament just above to it. This is the mid-inguinal ligament just above to it. Deep inguinal ring is presented. So coming to the boundaries of the canal. So normally there are anterior wall, posterior wall, and roof and floor. So anterior wall. Coming to the canal, the anterior wall is superficial to deep structures. Skin, superficial fascia, and muscles. External oblique aponeurosis, external oblique muscles aponeurosis, and the internal oblique muscle fibers. These are the structures which is presented in the anterior wall of the inguinal canal, which is superficial to the deep. In deep we have the muscles. Superficial we have skin, superficial fascia, external oblique aponeurosis, and internal oblique muscle. This is the anterior wall of the inguinal canal. Coming to the posterior wall, we have fascia transversalis, a conjoined tendon, and reflected part of the inguinal ligament. These are the three structures which is presented in the posterior wall. Coming to the roof, there are two muscles involved, such as internal oblique muscle and transverse abdominis muscle. So In the roof, there is the lower arched fibers of these two muscles, this which forms the roof of the inguinal canal. Coming to the floor, two ligaments are present: inguinal ligament, lacunar ligament. These are the two ligaments present in the floor of the canal. Okay, so this is the roof. Roof is formed by the lower arched fibers of the internal oblique muscle and transverse abdominis muscle, which forms the roof of the inguinal canal. Coming to the content, we have males and female have different content in the inguinal canal. So coming to the superficial ring and deep ring, there are different structures passing through it. So content of each ring differs. In superficial ring, the structures passing the content of it is ilioinguinal nerve and spermatic cord, whereas in females ilioinguinal nerve, ilioinguinal nerve and round ligament of the uterus. So these are the two structures in females. The common is ilioinguinal nerve, whereas in male spermatic cord is presented. In female, round ligament of uterus is presented. So coming to the deep ring structures, in male we have ductus deferens, obliterated remains of process vaginalis, testicular arteries and its accessory veins, and genital branch of genitofemoral nerve. So how you can, here is the mnemonic such as DOT, DOT for female. See, ductus deferens and its artery, obliterated remains of the process vaginalis and the testicular arteries and its accessory veins. And genital branch of genitofemoral nerve is the content for both males and females in the deep ring. Coming to the content in the females, round ligament of the uterus, which is the content of the superficial ring also, and the lymphatic of the uterus. This is also common in both males and females. The two structures which is presented in the deep ring of both males and females are obliterated remains of process vaginalis and genital branch of genitofemoral nerve. These are the two structures which is presented in both males and females in the deep ring of the inguinal canal. What are the two different structures? Such as testicular arteries and accessory veins and ductus deferens and its artery. Whereas in female, lymphatics of the uterus and round ligament of the uterus. So these are the contents of the deep ring, both in males and females. So coming to the mechanism. So this inguinal canal is more prone to the herniation. Hernia is nothing but the protrusion of some structures protruding outside. So to avoid this, there are some mechanism which is maintained in the inguinal canal. So first one is the flap valve mechanism. Flap valve mechanism is nothing but, so first this superficial ring and deep ring does not present opposite to each other or stay to each other. See, this deep inguinal ring and superficial inguinal ring is not stayed to each other. They are obliquely not stayed to opposite to each other. Okay, so that the transmission when the abdominal pressure increases, the pressure transmission from the superficial to the deep is not direct. So this will prevent the hernia. So coming to the guarding of the inguinal rings, deep ring is guarded by the internal oblique muscle, whereas superficial is guarded by the conjoint tendon and reflected part of the inguinal canal. So these are the posterior wall of the inguinal canal. So the guarding of the inguinal rings are mainly done by the posterior wall of the inguinal canal. So deep is guarded by the internal oblique muscle, whereas superficial ring is guarded by the conjoint tendon and reflected part of the inguinal canal. So coming to the shutter mechanism, the internal oblique muscle fibers will arch over the canal, and so that the canal becomes narrow during the contraction of the muscle. This prevents the indirect hernia. See, in the shutter mechanism, during the contraction of the muscle, the fibers of the internal oblique muscle arch over the canal, and thus makes the canal narrow. So next is this shield wall mechanism. So during this, external oblique muscle contracts. This makes the posterior wall to move against the anterior wall and prevents the hernia. Coming to the ball valve mechanism. So in this mechanism, during the contraction of the cremaster muscle, okay, during this contraction, the spermatic cord bulges up in the canal, which makes the canal narrower and prevents the hernia. So this is also one of the mechanism. So there are 5 mechanisms in the in maintaining the integrity of the canal to prevent the hernia. And coming to the clinical significance, we have inguinal hernia. Inguinal hernia is the sense in the groin area there will see in the groin area the inguinal hernia will be taking place. In the sense, the abdominal content will enter into the inguinal canal and protrudes out. So this is referred as the inguinal hernia. So here you can see this is the inguinal canal. So this is the inguinal canal. So there is a defect. So the abdominal content will protrude out through this canal. This is the abdominal content will protrude out through this inguinal canal. So which is referred as inguinal hernia. In inguinal hernia, we have 2 types, such as indirect hernia and direct hernia. So direct hernia in the sense this hernia occurs due to the weakness in the abdominal muscle, whereas indirect hernia is occurs due to the defect in the abdominal wall at the birth. During the birth, there is defect in the abdominal wall, so that makes the inguinal hernia, so which results in the indirect inguinal hernia. Whereas direct inguinal hernia is there is weakness in the abdominal muscle which is developed in the lifetime. So that is the main difference between the indirect and direct. So in indirect, where the content will protrude out, in the sense deep inguinal ring, whereas in direct, posterior wall of the inguinal canal. So first we will see the indirect, then we will come to direct, and then we will compare it both. So first, indirect inguinal hernia, which is defect in the anterior abdominal wall at the time of the birth, and the protrusion takes place at the deep inguinal ring, and the direction is normally oblique, that is downward, forward and medially, the direction of the protrusion. Okay, so coming to the age group, it normally occurs in the children. The indirect is normally occurs in the children. So coming to the direct, in direct there is weakness in the abdominal muscle which develops in the lifetime and leads to the hernia, and the protrusion is normally taking place at the posterior wall of the inguinal canal, and it occurs mostly in the old age or the adult people. Okay, so then the direction will be straight, direct. So that's in the mean direct inguinal hernia, the direction will be straight. Okay, so these are the main difference in the direct and indirect hernia. So these are all about the inguinal canal. So I think I have covered all. Thank you.